Jill has suffered from a hemorrhagic stroke. I am her nurse and I must explain to her mother what has happened to her daughter. I would first introduce myself as Jill's nurse and ensure to her that Jill is properly being taken care of. I will inform her mother that Jill has suffered from a hemorrhagic stroke in the left side of her brain, which has affected her ability to speak and movement in the right side of her body. I will educate her mother that a hemorrhagic stroke is when a blood vessel in the brain ruptures, which causes blood to leak into the brain. The leakage of blood affects the typical functioning of the brain. Specifically, this leakage caused Jill to have sudden blurred vision, slurred speech, and difficulty understanding others. As a nurse, I would first empathize with Jill's mother. I would explain to her that I understand that this is a difficult time and it's not easy to hear about the sudden change in her daughter's health. I will provide her with emotional support as she comes to terms with what has occurred to her daughter. After she's able to come to terms with her daughter's medical condition and properly rationalize what I say, I will educate the mother with necessary information and interventions that can help with the recovery of Jill's stroke. I'll explain to the mother that Jill is undergoing a few diagnostic tests, like a CT scan and an MRI scan, to assess and determine the effects of the hemorrhage on the brain. Based on those results, Jill will either be provided with interventions such as the surgery to stop the bleeding, medications to help with long-term effects of the stroke, or rehabilitation options to help Jill regain normal functioning. A stroke can be very debilitating and frustrating for the patient, which is why assistance in day-to-day activities are important to help Jill try to maintain her normal activities throughout the day. This is why educating her mother on emotional and physical support is very important to ensure positive outcomes for Jill. I would advise her mother to provide positive feedback, encouragement, and coping mechanisms to Jill while she's trying to regain normal functioning of her speech and mobility. Because the effects of the stroke can affect Jill's ability to understand my instructions, I will also advise her mother to ensure Jill takes all medications that are prescribed, help assist Jill in day-to-day activities she can't perform, and help cope with frustration when feeling hopeless. I will also advise her mother that she's not alone when caring for her daughter. She will have assistance from a physical therapist and an occupational therapist to regain mobility and maintain skills for daily living, and a speech pathologist will help her with vocal patterns and swallowing. And most importantly, I would advise her mother to reach out for help if she starts to feel burned out or is unsure of what to do.